Hi there, thank you so much for tuning in. Today we're going to talk about the new sterile drive line protocol here at Thomas Jefferson University Hospital for our LVAD patients. There are some updates that were made to the kits that will be coming out to patients' houses in the near future. One of the things that we have is a Silverlon patch. This is an antimicrobial patch that we're now using in all of our kits for patients. It helps prevent driveline infections. Many centers around the country are using it, and Thomas Jefferson University Hospital has decided to start using it as well. So to start, I want to just talk about what this kit is going to look like. It's a little bit different looking than the ones you've had. There is no cheat sheet inside anymore in terms of like the steps to go through, but there is still a packing list. I'm going to walk you through the entire dressing change, but to start, we're going to talk about what the changes to the actual kit are. When you open this and take off the packing list, you'll notice that there are some things that are outside the sterile packaging here, okay? That includes the bouffant caps, the masks, and our first sterile gloves. These things are what we're using when we're getting ready to take off the dressing. You do need to put the gloves on in a sterile manner, but these don't need to be given out in a sterile manner. So we have both of those. The other difference that we have is here is a new little packet that comes in, and this is to help remove dressings. It tells you right here. So you can apply this to the white part of the dressing to kind of help some of that tape come up. In addition, I'll show you how you can use it to help get this dressing up, okay? The next change that we see in the kit, when we open it, same way we always have. You'll notice again, you open it and there are the sterile gloves right here, wrapped in the protective white covering, but then there's a blue drape system in here now. So inside this system is everything you're gonna need to do the new dressing kit, okay? We have our 2 ChloraPrep, so instead of using 3, we're now only using 2, and then harnessing the power of the Silverlon to help prevent any infections. In addition, this is the silver patch right here. So we'll talk about all of those changes as we're doing the dressing kit change. I'll now walk you through doing this change start to finish, just so there's no confusion. Okay. So we've opened this out of the packaging. We're giving our patient their cap. I'm taking my cap. Everyone puts on their masks. And this Bioderm, we're gonna go ahead and use this right at the beginning, okay? To start, we've already washed our hands. We've prepped our area with our Sani wipes. Our hands are clean and dry. Okay, so we take this out and we just rub this right on the edge of the dressing. You'll notice it definitely moistens up that dressing a bit and helps it come off. Toss this off to the side, and we're going to use these latex gloves, latex-free gloves. We then proceed in the same way we always have. We will peel off the butterfly securement device at the bottom, and then we'll take down this, the dressing, starting at the top and peeling down this way. You'll notice that the Silverlon patch comes off. That needs to be changed with every dressing change, okay? So the anchor, we could take it off right now. We could have taken it off before we even started. This is not under the sterile dressing, so this can be done by the patient while you're washing your hands, or now, either way. We will take off our gloves. We'll head to our sink and we'll wash our hands for 30 seconds, okay? Antimicrobial soap, like we've talked about, singing happy birthday to yourself twice, or whatever song gets you to 30 seconds. Again, drying our hands from our fingertips down to our wrists, getting a fresh paper towel, fingertips down to our wrists. We're now ready to open up the white packaging to get into our sterile dressing part. We'll grab our sterile gloves off and put those on the same way we always have. We'll open up this drape, and starting over to the right, we'll grab our ChloraPrep applicator. We'll squeeze both wings till we hear a click. Watch the alcohol go down, affirm that it's there, and start right at the driveline exit site as we always have, with small circles, a little bit of pressure, just right here to really get this site good and clean. We stay here for 10 seconds. And then start to work our way outward for the next 20 seconds, making concentric circles. Those are bigger circles like the bullseye. Making sure we never go back to that driveline exit site. We don't want to drag any bacteria or any harmful things from outside this area towards that driveline exit site. Great. We'll toss this aside. We'll wait 30 seconds for this to dry, just as we always have. Once the skin is dry, we'll engage the second ChloraPrep applicator by pushing both wings, listening for the click, watching the alcohol come down, and confirming that it's there. Same process. We'll start right here again for 10 seconds right at the site where it exits. We'll then do our bigger circles for the next 20 seconds over and under that driveline site without moving it too much. Never going back to that center, always working your way outward. We'll wait 30 seconds again for the skin to dry. If you're someone who uses the skin protectant, some people have an allergy to this and don't use it, but if you've been using this the whole time, you'll continue to use this. You'll open up the packet, take out the wipe, and apply this in 1, 2, 3, 4 lines, just 4 swipes. This is just where the driveline dressing white part is going to be if you have a Sorbaview. If you use a Primapore, it's just at the edges. We don't go near the center with this wipe. Keep this wipe off to the side because we'll use it again at the end for our VAD anchor. Here's where the major change comes in for the driveline dressing. We have our Silverlon patch here, okay? This silver part, this silver side is the one that goes down on the skin, okay? The other side is white. So you always want to make sure the silver side is down and white side is facing out. We'll open this up. Try and keep it on the paper if you can. Make sure it doesn't bounce around. We need to activate this by getting it wet. So they provide a sterile saline wipe inside the kit, okay? We will open this up and we'll dab this 2 times with a good squeeze to try and get it wet, good and wet, and that'll activate the Silverlon. Give it a good push, you'll see water seeping out, and it is activated. You'll notice that there's a little slit in this. This goes from the top down around, right at the driveline exit site and covers it, okay? You don't need to wait any certain amount of time for the saline to dry or anything. You can then proceed with the driveline dressing change as normal by applying the dressing. We'll hold this bottom piece, peel back this slightly until we get to the white part so we can put it on perfectly. We can apply that just so that the Silverlon's right in the middle. Making sure there's a good tight seal there. Let's apply the butterfly. And then apply the VAD anchor as always, putting a little bit of skin prep wherever this is going to go. That's it. That's the new driveline dressing protocol change. If you have any questions, please contact your VAD coordinators. Thank you very much.